The multiplane wall scap mobiliser. A great exercise once again for the entire body. We are looking predominantly at the scapular setup, the thoracic area, and whether your clients are kyphotic or whether they move poorly in the lateral plane of motion in through the hip complex, or whether they just move poorly in the ankle complex, this is a great mobiliser for the entire body. To set up Ollie, what I'm going to do is have my hands around about shoulder height, maybe a fraction above, and all I'm going to get him to do now is allow gravity to load him and to go into a squat position. You can see by leaving the hands on the wall, what it does now is it drives the scaps into a nice frontal plane, also into rotation, and also slightly into the sagittal plane. Once again, you can see it's also loading the posterior chain, so we're getting a nice load in through the butt. And if we come down to the ankle complex, you can see now how it's creating a nice eccentric lengthening also in through the ankle complex. So if we call that sagittal plane, and once again Ollie's just letting gravity loading, so the timing's beautiful, he's not forcing anything, what we can do now is we can take that and progress that into the frontal plane. So he's going to release one arm, soften his knees, and he's not going to go too deep, he's going to stand up a little bit taller, that's it. And all Ollie's doing now is allowing the arm to become a pendulum. And you can see that when he allows the arm to become a pendulum, look what drives the scaps. So by loading the trunk, if you see how the trunk drives, realistically his spine isn't doing a lot of lateral flexion. It's actually following what the butt does. So when the butt drives out, what it does now is it helps stabilise, it helps upregulate the stabilisers of the thoracic spine, giving the scap a much happier time of movement. And once again, you can see the frontal plane, we're creating better movement now through the ankle complex, because remember, when we look at the ankle complex, the subtalar joint needs frontal plane movement to allow good triplanar movement in through the ankle complex. So a frontal plane movement in this manner will give them good activation or good loading, a good stretch in through the butt complex. Now we need to take it into a transverse plane. So all we're going to do now is Ollie's going to reach forward and rotate back. And as you can see, we have a bent arm, so we're taking the stress out of the scap. So for someone who has any sort of injury through the rotator cuff region or limited movement through there, this is a great exercise because he's now loading this posterior chain, which creates then an eccentric lengthening, creates a concentric contraction, which unloads it. So now it's the butt which is actually pulling the scap back. If the person moves well, we can actually let that arm reach and actually come up into more of an extension, creating once again a bigger unloading in through that anterior chain. But if you have a look at his thoracic spine, look at his hips, look at his ankle complex. Simply by allowing gravity and ground force and momentum to take place, we're now getting a much better movement and a much better upregulation of the entire stabilising mechanism.